and human health. Dr. Nidhi?
Can you please repeat that? Your voice is coming very feeble.
Okay. How does current research help us understand the connection between land degradation, climate change, and human health?
Thank you so much. That's a very pertinent question. It also very much links to the Rio synergies that we've been talking across the UN agencies and UN stakeholders. So to understand complementarities, and related to this, we also launched a report in one of the UN side sessions in the COP in Baku, and I think all the other COPs also picked up some of these statements coming for synergies. I would like to point specifically to a commitment, a multilateral commitment that's been steered by the United Nations. I'm a part of that, the UN Decade on Ecosystems Restoration, and that is again a trigger for countries to look into synergies on addressing multiple agendas and addressing triple planetary crisis to start with, which is biodiversity loss, pollution and climate change, and cutting and cross-cutting issues of land degradation, desertification, and managing dry land landscapes. Having said that, I think what we also need is not just synergies in or syncing of agendas, but also syncing of the pledges and the commitments in terms of financing arrangements, in terms of project and programs that are created and concepted in a way that they address these synergies in terms of having multi-stakeholder dialogues, which puts the stakeholders across these domains in a meaningful dialogue that leads to desired outcomes. Number two is also steering public-private partnerships. I think the private sector has been largely left behind in this process of multilateralism around these multilateral environmental governance agendas, from the UNCCD or UNFCC and more, and CBD. So I think we need to bring them also on the table. And third, I think also understanding the socio-economic realities and socio-cultural complexities, which I think have to find a place in documentation, but also in implementation and action planning. I will pause here.
Thank you, Dr. Nidhi. My next question is from Mona. Ms. Mona, I hope you can hear us. From a medical perspective, how does the condition of our environment influence human health? Can you hear us, Mona?
Hello. Yes, I can hear you well. How about now?
Should I repeat the question?
Yes, please.
Okay, the question is, from a medical perspective, how does the condition of our environment influence human health?
Okay, so restoration is something that we all do care about from a medical perspective because the ecosystem directly impacts the human health and also the biodiverse medicinal plants. I managed to put things together under the title of Look Beyond the Atmosphere, Climate Intervention to Nature Positive Restoration. And this can reframe the indigenous medical knowledge and the biodiversity conservation while integrating that from the planetary health perspective. So if you would allow me to share my screen and showcase the video presentation, do we have time now?
Yes, if you can be quick, yes.
Okay, so just bear with me. I'll showcase now my video presentation. It's almost like 15 minutes. Okay. So it is processing now. So if you can give me just a couple of seconds, I'll be able to do that. Because apparently my computer froze.
We can get another question from another panel. Right, Mona?
Okay, okay.
Okay. So we also have Domenico. Domenico, you can hear us? Okay.
Yes, loud and clear.
Okay, so the question for you is, why is the One Health approach important when discussing land restoration?
So thank you very much for the question, and thank you for inviting me. I'm very sorry I cannot be with you there, but unfortunately other commitments prevents to me to do that. So I will say first of all, One Health is a concept that is uniting the health ecosystem with human health and animal health. And of course, if we think about the health of ecosystem restoration and preservation are key to grant also health for all the living beings. So invest in such kind of activities is not just an investment in we can say environmental or climate action, but is also an action towards our health. Let's imagine, for example, when we have cities with a healthy ecosystem and green areas, these cities are preventing, for example, no communicable disease, stress related disease, and so on and so forth. So it's quite important to see these activities also on a healthy point of view. And of course, these healthy ecosystem can prevent from pandemic. We know everything from the experience of COVID. So I will say that for this reason, One Health can be a key of lecture or key of reading also on the activities that we are running on ecosystem preservation and restoration. And of course, also combat desertification is a clue on that for all regarding the nutrition, disease, and so on. Thank you very much.
Thank you, Domenico. Can we go back to Mona? Mona, you wanted to share your screen?
Yes, I'm almost there. Okay, so can you hear me well?
Yes, but speak a bit louder.
Okay, so just bear with me. Again, whenever I try to share screen, I have difficulties, but then I'll try to sort things out. Okay, so can you see the screen now?
Not yet.
How about now?
Now, yes.
Yes, can you see it?
Yes.
Okay, so let's get started.
Does it have sound, the presentation?
Yes, a little bit, not loud.
But we can't hear any sound. Maybe share it again with the option of sound.
Okay, so, but you can hear me now? So can you, Google, can you do it from your end?
We can hear the sound of the video.
Google, is it fine from your end?
Google, can you guys hear the sound of the video online? Yeah, we can see the screen, but no sound.
Okay, so I stopped sharing from my end. Yes, I can hear now, Kuku. Thank you.
We cannot hear the sound. Gokul, we cannot hear the sound of the video. Can you hear us? Yeah, but we cannot hear any sound of the video. Maybe, maybe Mona can just without the video explain.
Yes, of course. So keep it on, Kukul, and I will speak on the video, okay? Okay, so the implications for the UNCCD is consequential, and the well-known illustration featuring a traveler reaching beyond the apparent boundary of Earth, published in 1888 in Camille Famillon's L'Atmosphère Météorologie Populaire, represented the 19th century effort to understand atmospheric processes through the emerging sciences of meteorology and astronomy. And here I talk about the publication of Julia Shepard, who published in her study Science State Alliances and Climate Engineering, a long jury picture tracing the Earth's climate from late 1950s through the early 21st century. Her analysis shows that climate engineering is not simply the product of recent technological innovation. It has developed through a long relationship between scientific knowledge, state institution, and political ambitions to predict, manage, and potentially modify atmospheric processes. And here you can see the picture of carbon dioxide removal and solar radiation management, which does not give solutions to the biodiversity extinction. So a nature positive frameworks makes this distinction explicit. It argues that preserving the remaining intact of nature is the most urgent priority because ecological losses and carbon stocks accumulated over centuries cannot necessarily be reconstructed within the time available for climate stabilization. Restoration remains essential in degraded landscapes, but prevention of further ecological loss has greater immediacy. The missing dimension is that biodiversity policy has traditionally focused too heavily on patterns and predictive models and insufficiently on processes. We can understand this better through the HEMA system based on the prophetic teachings of the merciful and protective approach, which means HEMA in Arabic, to the grand scheme of the natural world. And it is one of the most widespread conservation systems globally. UNEP publication Al-Mizan, A Covenant for the Earth, describes Al-Haramain Al-Sharifain, the inviolable sanctuaries in Mecca and Medina, as primordial protected areas, an early model of place-based ecological protection in which the web of biodiverse species are protected and preserved as communities like yourself, as quoted in the Quran. A recent ecological research in the sacred sites of Mecca recorded species richness by 90.9%, with 82% species turnover and 66% of the taxa missing compared to the earlier survey. The authors attributed this change in floristic composition to afforestation that facilitated invasive and disturbance-tolerant species. And this study shows that conservation is not simply a question of how many species remain, but of whether the greater ecological relationships at the planetary scale remain functionally balanced. Here, you can see the chart of the 3 global conditions framework, which identifies 26% of the terrestrial areas as wild areas, and 55% as shared landscapes, and 18% as cities and farms. This framework is useful because it rejects the idea that one conservation strategy can be applied uniformly. And nature positive is therefore not synonymous with restoration everywhere. And it calls for a differentiated strategy of protection, sustained management, and restoration according to the ecological condition and the people who inhabit those landscapes. And so it argues that usually restoration occurs in areas managed by indigenous people and traditional communities. Their knowledge is derived from sustained observation and interaction with particular ecological context, and they propose that respectful engagement in an ethical space is required. So this naturally creates a bridge between indigenous and local medicinal knowledge on biodiversity, cultural heritage, ecological indicators, and sources of community health knowledge. The indigenous people conservation is therefore a practical mean of connecting biodiversity, protection, and cultural identity and planetary health. A genuinely nature positive approach is therefore to seek to restore the ecological function and human capacity to steward it. In this paper, Conservation with Local People, Medicinal Plants as Cultural Keystone Species in the Southern Alps in Italy, it assessed 273 native medicinal plant species and identified 10 leading candidates for the status of the cultural keystone species. Their methodology combined ecological information about plant habitats with their significance to local communities. The concept of a cultural keynote species is important because conventional conservation often privileges ecological indicators while overlooking the cultural histories that help shape landscapes. So in this paper, the findings are especially instructive because medicinal plants were not isolated pharmaceutical resources. They were embedded within the food, veterinary, cosmetic, household, and spiritual uses. And 8 of the 10 leading candidates had medicinal uses supported by pharmacological evidence, as we can see in this table. So this model became more significant when viewed through planetary health and the biodiversity of the vulnerable communities. Now we move to Iraq. Iraq illustrates this interaction with unusual clarity. Abdullah Shihab's 2026 analysis of the Planetary Health Alliance describes a food system under simultaneous pressure from water scarcity, recurrent droughts, degraded soil, geopolitical instability, and uneven public investment. Agricultural production has become increasingly vulnerable to water stress and climate uncertainty. Satellite-based assessments indicate that vegetation stress has shifted from an occasional to a recurring national pattern. The problem is not simply insufficient wheat. The Iraqi food system has historically depended upon a more diverse combination of crops, livestock, and locally grounded agricultural knowledge. Increasing concentration around wheat has created strategic advantages for stable security, but also reduced dietary and agricultural diversity. The decline of maize, sesame, vegetables, food croppers, and mixed farming reduced nutritional and ecological resilience. And so the planetary health interpretation here changes the policy question. The issue is not simply how we can produce more wheat. It is how to restore the ecological and social conditions under the diverse food system that can remain viable. Here we move to Somalia in the Horn of Africa, which demonstrate what happens when climatic shock interact with ecological and socio-economic vulnerability. According to the UN February 2026 reporting, the number of people experiencing acute food insecurity in Somalia has almost doubled to 6.5 million within a year. More than 1.8 million children under 5 were projected to face acute malnutrition through June 2026. The crisis followed failed dairy rains and declining crop production and high food prices. And so these statistics cannot be simply interpreted as evidence of inadequate emergency response. They demonstrate the importance of pre-crisis resilience. And so restoring rangeland can support livestock during climatic stress, better water harvesting, and climate forecasting. All of these should be the objectives to connect humanitarian preparedness with long-term ecological restoration. At this point, the connection between geoengineering and land restoration becomes clearer. The deeper question is conceptual. We can argue that policymakers can think of climate as an engineering variable that can be adjusted independently of the living systems that make the planet habitable. The nature-positive approach treats humanity as embedded within nature. Such cultural perspectives argue that indigenous and local knowledge must contribute through respectful engagement in an ethical space with empirical science. The economic dimension is also important to stress on. I just have like 4 minutes to finish this presentation because the economic dimension here, I just want to stress on that $7 trillion annually are reported in net negative nature negative financial flows, and we have a significant bottleneck in the global sustainability of the environment. And finally, to conclude, because here, as you can see in the pictures, the target of the Sustainable Development Goals together with COP17, they emphasize the economic pressure with the Riyadh Pledge for land restoration. But still there is a financing deficit. So to conclude, the historical significance of Flammarion image featuring a traveler looking beyond the apparent boundary of the world can be read as an image of scientific curiosity. A century later, that curiosity has developed into the capacity to observe the Earth at planetary scale and to deliberately intervene in its climate. The challenge now is to determine what intellectual and institutional framework should guide that capacity. The nature-positive framework argues that the Earth system stability depends upon the integrity of the living systems and the natural processes connecting them. The Southern Alps research demonstrates that cultural knowledge and biodiversity can be integrated through the concept of the cultural keystone species. Iraq demonstrates that land, water, agriculture, and health form one food system problem. Somalia demonstrates how drought can rapidly become a humanitarian crisis when ecological and socio-economic resilience are weak. Taken together, these studies suggest a more demanding proposition than conventional restoration. For the Middle East and North Africa, I'm based in Egypt, so this really concerns us that a bioculture restoration strategy is particularly relevant because drought, water scarcity, agricultural vulnerability, land degradation, and biodiversity loss are already interacting with food insecurity displacement pressures. Iraq and Somalia demonstrate different manifestations of this vulnerability. So the strategic opportunity at COP17 is therefore to make land restoration the connective tissue between climate policy, biodiversity policy, and planetary health. Nature positive provides the ecological direction, indigenous and local knowledge provide the place-based knowledge and stewardship, planetary health provides the human health rationale, and the most important shift remains to be conceptual. Restoration should no longer be understood as repairing what has already been lost. It should be understood as rebuilding the conditions under which biodiversity, ecological processes, knowledge, food systems, and human societies can remain resilient together. Thank you so much.
Sorry, the mic is off. That was quite informative, Ms. Mona. I'm sure we'll further work on the dissemination of your knowledge. Coming back to my brother, what can traditional knowledge teach us about restoring and protecting medicinal landscape?
Okay, quite a very interesting question, and I would like to thank all the panelists here for what you shared because I think it was a very interesting one, and it really set the point on the scientific dimensions of the land degradation and also to the health that we need to address it right now. So the question, uh, I think we have. If, no, I think so. When we talk about the traditional way, the traditional. Sorry. Okay. Okay. So about the traditional knowledge, I think here the most important thing to say first is that we are in a multilateralism event right now, but sometimes most of the things that's really working under multilateralism. But most of the things is working underground. Because underground, when we talk about land restoration, most of the solutions can come from the ground. And we can mostly that, for example, in Madagascar, when we want to bring some solutions, most of the times the people from the ground is already, they already know what the solutions are really trying to bring. The thing here is still the main point. Because, for example, we have in Madagascar what we call the fence, which means the taboos, which means that it's a kind of I think that people may think that it's just a superstition, but in fact, it's not a superstition. But somewhere there is some um, wisdom that the ancestral is trying to tell us as well, and we can say that it's even a mechanism or a social economical it can be just a kind of equilibrium that we would like to set in economical and social situation. So I think here the most important thing to say is that we need to value the ancestral knowledge. We need to value the local regulations as well. And we can also see that those things are wisdom, and we need to turn those practices into a lever against land degradations. As an example, in Madagascar, for example, there are some places, there are some community forests that people are preserving, and we have, like, for example, an incitation from the elder people to say that you cannot enter this forest because it is it's hazardous, for example. But in fact, inside this wisdom, the idea is to say that you do not go there and cut everything that you want to cut. But there is things that you need to respect, and that's the local rules. That's the wisdom that you need to preserve as well. And these things, those tools can be used as well to restore the land and limit land degradation. Thank you.
Thank you. That was fresh knowledge for me. So coming back to our online panelists, the next question is from you, Dr. Didi. I hope you can hear us. So where do indigenous and traditional knowledge systems fit within the climate health evidence landscape? Dr. Didi, can you hear us?
Sorry, I'm not hearing you very well. I might have to request you to repeat.
If I repeat, okay. Again, can you hear me now?
Yes, I can. I missed some words, but overall, I'm able to understand.
So the question is, where do indigenous and traditional knowledge systems fit within the climate health evidence landscape?
I think, again, a very relevant point, the indigenous knowledge and value systems, they fit. Conventionally, the processes and the frameworks and the approaches related to climate mitigation or adaptation or resilience building were not designed to fit indigenous knowledge. However, I think if we look back, we can always find some space to use some kind of more narrative-based or storytelling-based modalities to integrate larger, broad understanding. But we have to think differently from conventional science. We can't really look for quantitative indicators all the time. We have to look for more qualitative, story narrative-based. These may not have been as peer reviewed as we would imagine it to be. So we have to also think a little bit from in a different manner to not use the same lens to evaluate indigenous knowledge integration into decision making or policy planning. We have to keep a more broader mindset to see that these are sometimes spoken knowledge, sometimes knowledge that is passed from generation to generation, not necessarily documented in paper format like Western science. So I think we need to be a little bit accommodative in the sense there are now many communities, and I was a part of one such project for past 10 years for First Nation communities in Canada, and they have also understood that they need to document some of the knowledge that is passed from generation to generation or is only spoken or oral knowledge, oral histories that we call it. From a pedagogical viewpoint, if they are also starting to document them in some format so that this knowledge becomes more accessible and interpretable by a larger spectrum of decision makers. And for that, they also need project support. So they need to have some kind of funding through which this knowledge that is now more or less concentrated within communities can become mainstreamed to then find this pathway into decision making. The second point which I would like to emphasize is that as much as we want to understand how indigenous systems or knowledge can be integrated into climate evidence or policy related processes, the indigenous communities are also very keen to understand what are the current formats or approaches or frameworks that are part of the planning process, so they can fine tune or they can refine or reframe their knowledge to fit in that. So it could be a bilateral learning process, and that's what we tried in Canadian context. Some things that have come really useful in doing so is like virtual reality. More visual based learning is something that communities are more leaning to, or is more appealing to them, rather than very document heavy text or report based format. So we have also learned that formats like digital twin, virtual reality, or artificial intelligence based scenario generation could be more easy, visually appealing modalities to connect with communities and provide an evidence that they relate to and they find more meaningful to become an evidence in climate related policy and decision making process. So these are some examples. And I think one thing which I would like to take a closing note is targeting stakeholders within the indigenous communities who are carriers or knowledge bearers in different demographic spectrum. So with youth, we can use more technology tools. With elders, we need to use more narrative or story-based format. With like in Canada, we had these grandmothers and who were knowledge holders for the community. With them, we need to use a more conversational, trust-building modality. So I think there could not be a blueprint to connect with indigenous communities if we need to generate evidence. We need to be have a customized, tailor-made approach to connect with the different spectrums of the demographic landscape. So I think these are a couple of points that I've learned from my own research working with indigenous communities, and I'm happy to elaborate on any one of them if needed.
Thank you, Dr. Lily, for the really valuable points. Thanks for connecting all the various points. Coming back to Domenico, I hope you can hear us. The question for you is, what is one change you would like to see in the way we approach land and health?
I don't know. I didn't hear very well the question. If you can repeat, please.
I'll repeat. What is one change you would like to see in the way we approach land and health?
So I want to see the we can say understanding that first of all, soil and land are limited resources. Sometimes we think that we can use soil as much as we want, and soil just because to our scale as human being it seems more greater than us. We think that we can use as much as soil as we can. Indeed, soil is limited. That's the first thing. Second thing, we need to understand that the soil itself has a life. For example, I think that you all know, and land, of course, as well. For example, that the health of a piece of land that is like a forest or agriculture and so on is really connected to the so-called fungine web or like bacteria web that is connecting different areas, and also roots web. Okay. For example, the conventional, not traditional, conventional agriculture thinks that we have to move the soil to make it productive, but is exactly the contrary, because the first 10 centimeter of soil contains this intricate network that is also communication of signals between plants and bacteria that is essential for the health of the land. So these understandings, first of all, the limitlessness of the soil and land consumption, and second, the real web of life that is pertaining the healthy soil and healthy lands.
Thank you, Dominic. Now, a reflection question from Ms. Mona. Should health be considered an outcome of land restoration? Ms. Mona, can you hear us?
Yes, thank you so much for your interesting question. And this brings us again to the indigenous knowledge, because they value the seasonal patterns, they value everything that has to do with the macro and the micro ecosystem surrounding them. And also, as we can say, that the interaction between the biodiverse ecosystems, biotic and abiotic, that represent the Earth system stability, all of which, you know, contain the species level, their genetic diversity, and also the aquatic and the terrestrial environments. All of this lies within the traditional conservation methods, which is directly affecting the, like we call it, the epigenetic factors affecting the human health, from the cellular to the cosmic scale. So, of course, there is a direct means to try and look in depth into this kind of knowledge, because it is all about how can we live together in a sustainable environment. Thank you.
Thank you, Ms. Mona. So now I will move to some cross-panel dialogue. Last part, and maybe all the panelists can just contribute a little bit on this. So, asking about land restoration. If we were restoring one degraded landscape today, what medicinal, ecological, or cultural element should we make sure not to leave behind? Okay, let's ask from the online panelists. Anyone can contribute. Dr. Nidhi, can you hear us? Yes. Okay, I'll repeat. If we were restoring one degraded landscape today, what medicinal, ecological, or cultural element should we make sure not to leave behind? Thank you, Gokul. So I'll just move to the next question. It's about biodiversity. Maybe Ms. Mona can answer it. Can medicinal plants become entry points for restoring wider biodiversity?
Okay, so about medicinal plants, actually their properties and their pharmaceutical active components is some sort of, you know, like it lies within the realm of the indigenous knowledge. And so it depends on the type of the land, whether it is rangeland, whether it is wetland, or something that has to do with pasture land, like in Mongolia, where you are. So that's why for every community, they have their own geographical distribution with their own biodiverse medicinal plants. And this nourishes their own gut microbiota, which is equivalent to the microbiota of the soil where they are inhabiting. So that's why the generalization of like a magic medicinal plant that can fit into the context of all populations, this is not really a good idea because every community and every population health is shaped by the type of food, their dietary lifestyle, and their climate. So we need to understand better the context of the ecology of the people who inhabit every geographical area. Thank you.
Thank you, Ms. Mona. So I will come back for the youth question because you've been part of the spaces. What role can young people play in carrying this knowledge to the future?
Oh, very interesting question. For this question because it really depends on where you live and it depends on how is our connection with this kind of information. I think the main goal of young people take this to ensure first of all that there is the knowledge and to apply it the thing that it's an important knowledge. It is to be aware of and to bring it to the other generation, to the future generation. I think that's the one important thing to do. And then secondly, to get capacity buildings in which we can understand more the importance of local knowledge as well. So we can also sensibilize. I think those two things are the main things that are important and also to raise awareness in the young people that's what I get aware of this. So we could also work on this on the importance of that medicines and traditional medicine.
Brother. So just because we're short of time, so we'll just move to the last closing part in which each of our speakers is going to complete this sentence. And the sentence is to restore the health of our land, we must dot dot dot. What should we do? So I just ask the speakers one by one. Maybe Dr. Nidhi, you can complete the sentence to restore the health of our land. We must. What? Dr. Nidhi, can you hear us?
I heard you, but maybe you might have to, sorry, to ask you so many times to repeat.
No worries. To restore the health of our land, we must. You have to complete the
We must
sentence.
restore our land, our water, and our air.
Okay, thank you. The same question from you, Domenico.
Sorry again, if you can repeat, please, because it was the audio was very weak.
No worries. You have to complete this sentence. To restore the health of our land, we must. Dot, dot, dot.
We must cooperate using integral ecology as a framework.
Great, thank you. Miss Mona, the same question for you.
Yes, okay. So I think that we must create a natural bridge to the indigenous and local medicinal knowledge, and in short, to restore the ecological function and the human capacity to steward this land. Thank you.
Thank you. Gopal, yes, you can also complete. Must. Thank you. The same question for you.
We must co-create solutions in local communities.
Because without local communities, there is no solution. So thank you so much to all the physical participants and also to our panelists joining online. Yeah, maybe if everyone can turn on your videos, let's have a group photo. Yeah. Thanks to you, Google, and also to all our panelists. We will definitely have further engagement around the same topic. So I would like to close this session in a statement. Restore the land, restore biodiversity, restore knowledge, restore culture, restore health. Everything is interconnected. Thank you so much, everyone, and to all our organizers, our panelists. It was a really impactful session, and I hope we will continue these conversations beyond COP17 as well.
Thank you.
I think since we are still connected online, I think we can share the work we're doing as well. I think it will be great since I'm working with an organizations as well in Madagascar. So yeah, I will share the link and maybe we can still continue to connect online.
Thank you so much. Bye bye.
Also, thanks to the UNCCD doctors team for giving us excellent support. Thank you so much, and see you.